The Trump administration is making sweeping changes to Obamacare, and they're going to end Dreamer coverage. So did you know, because Dreamers are illegal aliens, or the children of illegal aliens who are also still illegal, and not only were they being allowed to stay, even though they were illegal, we were giving them free health care, or they were able to be added to health care. I'm not sure exactly how the system worked, but the bottom line is non-citizens were getting health care from us. So this program seems to have ended. The Trump administration is shortening Obamacare's annual open enrollment period and ending the law's coverage of immigrants who entered the U.S. illegally as children, according to a final rule announced Friday. The Biden administration made it easier, because of course they did. They were trying to encourage illegal immigration into the country, and more affordable to sign up for Affordable Care Act plans, causing enrollment to swell to an all-time high. The Trump administration claims those moves opened a wave of fraudulent enrollment, which possible. That's costing taxpayers billions of dollars. Also possible. In fact, probable is more likely. According to the rule, the federal open enrollment period will now run from November 1st through December 31st. Currently, federal open enrollment ends January 15th. States operating their own health care insurance exchanges will have the flexibility to set their open enrollments so long as they run no longer than 9 weeks between the November and December dates. In addition to the shortened enrollment period, the administration said it is ending Obamacare coverage for immigrants who came into the U.S. illegally as children, also known as Dreamers. Of course, they had to give them some flowery name because the point was to do emotional blackmail to encourage Americans to accept them as citizens, to just add more people who would then turn into anchor babies, inevitably drawing their families in as well, as we saw with amnesty in 1986. Now, the provision that Trump's administration is doing will undo the Biden-era rule that was estimated to allow 147,000 immigrants to enroll in coverage. Now, here it says immigrants, but I wonder if it meant illegal immigrants. A federal judge blocked the rule from being enforced in 19 states, and it is still being litigated. The administration also banned plans for covering sex trait modification. Why would we want to cover sex change operations of any kind? Not only is it coddling mental illness, it is a monstrosity that we are doing to people by permanently altering them. Doctors wouldn't do it if you wanted to chop off your leg, but they'll chop off your ding-dong. All right, well, there's that. Anyway, the policy will apply to the 5 states that currently include coverage for gender-affirming care, meaning gender mutilation care, as well as in states that do not have such coverage expressly mentioned. But many of the other changes announced Friday will likely require more income verifications for people to enroll in coverage on federal exchange plans and will last only a year. The 1-year sunset is a change from when the rule was proposed in March. It is designed to give Republicans on Capitol Hill an opportunity to codify the provisions into law for the long term and use the savings to fund their massive party line tax and spending bill. So they're giving them a chance to add it to the big, beautiful bill that Trump has. According to the Centers for Medicare and Medicaid Services, or CMS, the rule is projected to save up to $12 billion in 2026 alone by reining in wasteful federal spending and refocusing on making health insurance markets more affordable and sustainable for hard-working American families. But of course, as we've seen, when it comes to the left who doesn't like this, they'll say, what's $12 billion? That's nothing. Because that's what they do. Now, the rule requires federal exchange plans to check consumers' eligibility for special enrollment periods and raise the burden of verification for people who are automatically re-enrolled in subsidized plans. Sounds like a start. The rule also requires plans to charge these people a $5 monthly premium until they confirm or update their eligibility information. Well, that seems pretty reasonable and pretty light. The rule also ends a monthly special enrollment period for people with income below 150% of the federal poverty line, which CMS says has been exploited to enroll consumers or change their plans without their knowledge. Well, it's not much, but it is a start. And the bottom line is the Dreamers should never, ever, 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 ever been allowed access to health care in the United States. They are, after all, illegal aliens.